Cesarean births, believed to be named after the ancient Roman ruler, are now a common way for doctors to help ensure a healthy outcome for mother and child. In fact, 1 out of 5 children in this country are born C-section. Today, at Virtua West Jersey Hospital in Voorhees, New Jersey, Jennifer and Larry Young's expected twins will be delivered by C-section. Jennifer Young is 32 years old. She has a 2-year-old daughter, Sydney, and she is in her 9th month of pregnancy.
She is due in exactly 2 weeks, so she was 38 weeks pregnant, and that's about the time we scheduled an elective delivery for twins. The reason for the C-section was that baby A was presenting in the breech presentation. So we had planned this probably for 2 months, knowing that A was breech.
They're transverse.
Okay.
One head here, usually one head is
one
here.
over here. And they call them which one A and which one B?
The A is A and
one
B.
with the head down and this one B. Okay.
Right.
Twins, that's the simple part. But when you really think about it, it's like college, 2 at the same time. That's the scary part. The twins are the easy part.
We're just going to be looking for, make sure that they haven't switched and decided to be head down.
With twins, it's less likely that that first baby will turn. There's just not enough room for it to maneuver itself around. With baby B, its brother hanging around above it.
The head of one, the lower one is here, and I think his body comes around.
So they are both pushing down on this way.
Time to come out.
Time to come out.
Good morning, Danielle.
Good morning.
Danielle Nacito is 25 years old. She has a 6-year-old son, Matthew. She is also full term.
Baby looks great. There's the heartbeat. Nice.
Danielle and Jim Nacito have scheduled a C-section today, but for different reasons. Danielle gave birth to her son Matthew 6 years ago in an emergency C-section. It was a traumatic experience she does not want to repeat.
6 years ago, Danielle had a cesarean. It was emergent. The baby's heart rate suddenly went down, and we had to do an emergency cesarean. And we spent a lot of time in the office talking about this. But after Danielle's previous experience, she much preferred to just come in and have an elective repeat cesarean section.
In a C-section, an incision is made in the abdomen and then the uterus. The cut to the uterus is made across the lower end of the organ so as to not weaken it in future pregnancies. The rising rate of C-section births has become controversial.
No question that the cesarean section rate has gone up significantly. It's gone up from somewhere around 5-6%, which it was perhaps 35 years ago, to somewhere in the neighborhood of 20 to 30%, which it is today.
The rising rate of C-section births has become controversial. No one is sure what is causing the rise in C-sections, but medical experts suggest it could be anything from economics to societal changes.
It's complicated. There are probably many different factors involved. There's just a whole host of medical factors and non-medical factors. There's some social factors, there's medical legal issues. Some of it's increase in medical knowledge, and some of it's a whole change in the way society looks at pregnancy and delivery, too.
Surgery takes about an hour from beginning to end, not including the prep time before and the time after, getting you cleaned up and everything. And but you'll be basically awake the whole time. Anesthesia will be right there at the head of the bed with you. If you're feeling anything, if you're uncomfortable, if you tell them, and they'll take care of you.
Commonly when women go into labor and they take prenatal classes, the focus is on vaginal deliveries. They know there's always a chance for a cesarean, but that's certainly not what's anticipated. Commonly women feel defeated or that this isn't right, and some become somewhat depressed if they don't have the birthing experience that they had anticipated.
To plan for this one, to better understand the C-section, I spoke a lot to my doctor.
There's not much mystery to this right now. There's a better understanding of what's going to occur as opposed to not knowing what was happening. So that made it a lot easier on us to make a decision, to feel more comfortable with what was going to happen.
Jennifer is now ready for her C-section. The walk she takes to the operating room is important both for her and her entire family. C-section deliveries involve a demanding set of skills and requirements from the medical staff. One requirement is an adequate supply of blood for every patient. One patient, Jennifer Young, is expecting twins, which means she may experience increased blood loss during her C-section. Medical experts attribute the additional blood loss to the larger incision necessary for delivering twins. All labor and delivery patients have a blood specimen drawn in the event a transfusion is necessary.
If they call, I would be the one to cross-match the blood and then got it ready for whoever's going to come pick it up or take it upstairs, depending on the situation. They would call, we would go in this program, and it brings up this screen. It gives us a type and X number. Every patient has a type and X, and you have to match up the number at the bottom with whatever's on our computer to make sure it's the same patient. This is where we put the units in. These are negatives. If we have a specimen already, it would only take 5-10 minutes for us to get the blood and then have it upstairs.
Patients Jennifer Young and Danielle Nacito have already had their blood types recorded. Both are now going through the final stages of preparation for their C-section surgeries.
In order to relieve pain or do a procedure in a pregnant patient, you like to try to avoid as much systemic medication as you can because of the baby. So when they come in for a C-section, we can either do an epidural or a spinal. And a spinal basically does what an epidural does, only a lot quicker, a lot faster, with a lot less medication, and it's overall, I think, the preferred anesthesia for C-sections.
Is this heavy yet?
No, not really.
Not yet.
Before I have surgery, just get mentally ready for the surgery, get prepared for what might happen. And I always get a little nervous. My heart rate goes up a little bit when we start C-section. I think that's a good response for a surgeon to have. You can't be too casual.
You can bring your husband whenever you want, Jean. Come here. Come here, honey. You can scooch up here if you want. Sit right next to her.
Danielle Nacito and her husband Jim are preparing for their second C-section birth.
How you doing?
Good, how are you?
Good, good.
How you doing?
How you doing?
Good.
You all ready?
Yeah,
Yeah.
I'm ready.
Much less eventful than last time.
That's right. We were just talking about that.
All the excitement?
Yes.
Yeah, I named one of my gray hairs after you.
The Matthew gray hair.
That's right. So we got the game plan. We're going to take out the old scar and make it look pretty and have a beautiful, healthy baby.
Yeah.
This is our OR table. Mary Jo's setting it up. It's specific to a C-section. We have all the instruments we need for a C-section, suture, sponges, all the gowns for the physicians. Her Mayo stand is over there with the things that will be close to the table for the surgery. Back in that corner over there, you have your prep tray, which the doctor will use to prep the patient's belly before the surgery actually begins. There's 2 sterile basins over there with sterile water in it that's used during the procedure to wash the mom's belly or to clean her off if they need them. Once the baby is delivered, the neonatologist will bring the baby over here, place the baby in the warmer. It's a radiant heater. You can feel the heat coming down from here. Blankets are warm. We have all our emergency equipment for the baby. We have our bag and mask. We have our suction equipment. We have a bulb syringe.
So we're going to have a nice baby this morning. Much less eventful than Danielle's last baby.
It's been a long 9 months, we're ready to go.
Jennifer Young is giving birth to twins today. She will be undergoing a C-section because one of the twins is in a breech position. The other is in a transverse position, which means the baby is stretched across her uterus.
The normal cesarean section, we usually use a low transverse skin incision. We use a scalpel to open the skin, and then we go down through the layers. Let's grasp that. That's good. We check position of the baby at that point. We usually make a low bikini incision on the uterus, and that's the last step before we get to the baby.
I can't really see over your belly. Just about down to the uterus, okay? Now you're going to feel a lot of pressure up here.
Again, we double check position. One physician puts their hand in, and usually it's the head coming. And this was the breech initially, so we got the rear end out first. Your assistant gives pressure on the top of the uterus to give a little oomph to pop the baby out. Usually they come right out. Okay.
You can't get up. He can.
There's got the anterior shoulder right here. Okay. There's A. Okay. Lay him down. Let's get him suctioned.
Oh, cutie.
There's the first one. There's one. Here he is. Say hello.
Hey! It was a little messy right now.
Okay.
One down, one to go. There's some more pressure, honey.
Suction. Nuchal cord times 1 with B. Let's make sure we keep the cords straight, okay?
Now, actually, they're going to be judges.
Another cute one.
There we go. Hello. Oh, you're a holler.
Good God.
You're going to scream too, aren't you?
That's what I said. They're really
look
big
like
for twins.
B is bigger. He said, I'm screaming hello.
You missed him too, didn't you?
He's bigger. Okay, you've got B. Okay, this is A. That's B. Okay, give me a cord clamp for B. So, and we're just gonna, we have the Kellys on A. Analysis. Let me just check her cervix. Placenta, good size placenta for 2 babies.
Oh, look how cute. No, leave me alone. Put me back. Put me back.
Both nails got to be cut. There you go.
All right, Dad, got those arms ready? Now let Mom give him a kiss. And I'm going to give him to you. Say hi, Mom. Say I'm beautiful. Look at me. Next cabinet over. Bottom right, behind the box. Next to the catheter.
Close this soon here.
Doctors are still working on Jennifer Young. They fear she is losing a lot of blood.
Dr. Miller, we have one micro left. Would you need anything after that?
Let me see.
Get it ready?
I'll probably need 2 ovicals.
No, we don't need it in the unit. We just want type and cross. Thanks. Mom was having some bleeding in the uterus after the babies were born. The babies were both good size. We don't have their weights yet. The uterus was very hyperextended from the size of the babies. We had already had her type and X'd for blood, so all we had to do was call the lab, and they would type and cross her immediately, and we have 2 units on hold if she should need it. Right now, everything's under control. Her bleeding has subsided. The uterus is intact, and they're proceeding to close her up.
Transfusion never happened. Her vital signs were never unstable. And then because the uterus is over-distended, she's got 15 pounds of baby in there rather than 8. For a regular full-term delivery, you expect to encounter extra bleeding. So she had a little bit more than average blood loss, but I think she'll do fine. We just need to follow her bleeding and her hemoglobin. I'm sure she'll be a little bit anemic, but luckily most of our patients are young and healthy, and they recover very well from delivery and cesarean section.
Meanwhile, the C-section for Danielle Nacito is about to begin. Her doctors plan to cut through the same scar used for her emergency C-section 6 years ago. Six years ago, Danielle Nacito underwent an emergency C-section delivery for her first baby. Today, her doctors are performing a scheduled C-section to avoid any complications.
Usually we don't do an up and down scar, but in Danielle's case, it was an emergency cesarean. So we did, so we could get in quicker. Okay, 1 scar.
No prep
Give a
for
second knife.
Give me some contractions at all, or? No?
Okay.
Anything else to do?
Okay, bladder blaze. Here's her uterus we're approaching. Okay, let's go the other way.
Lots of suction.
Okay, get ready for baby. Take that out. Gonna feel a lot of pressure, okay? Ooh, what a cute little face.
Stand up. Right here.
He's got a lot of hair. You want to look up, Jim?
Oh my goodness.
Stand by the head, saluting.
Oh, look.
Oh,
little girl.
Yep. Say hi.
Holy kid, look.
She's adorable. So we're going to let him freshen her up,
goodness
okay?
gracious.
And then they'll bring her right back to you.
Fantastic.
She's beautiful.
Lots of hair.
Oh, you gurgly.
Emily is having trouble breathing.
We're basically waiting for her to establish her breathing.
Right hand.
And her color, as you can see, her color is already pinking up. Her lips are nice and pink now.
How's everything look so far?
Yeah, pretty good.
No problems?
As expected, there was a lot of fluid coming up from her lungs.
Okay. Is that normally after a C-section, or?
I'm sorry?
Is that normally after a C-section?
Yes, yeah. And that's really because inside the uterus, the baby's lungs are full of fluid.
Okay.
They don't need to use their lungs, so they can't use their lungs when they're in the uterus.
Okay.
And that fluid needs to either be expelled or to be reabsorbed into the bloodstream.
Okay.
And occasionally it might take a while in some babies, especially if they've not gone through labor.
Okay.
So we'll see how she does over the next few minutes. If her breathing is not settling down, then we will take her down to the intensive care nursery and see how she progresses over the next few hours.
Okay.
Doctors are concerned that Emily is still breathing too fast, so they will transfer her to the neonatal intensive care unit to monitor her more closely.
Yeah, she is still breathing fast. I'm not counting the rate that she's breathing at, but I would assume that she's probably running at about 70 or so at the moment.
Okay. And where she should be? She
should be 60 and under.
60 and under?
60 and under.
Okay. Thank you very
Mom
much.
came to say goodbye. Sweetheart, look how pretty I am. I'm going right across the hall to the transition nursery before I make my stop to the admission nursery, just so they can watch her a little closer over there. And then she'll go upstairs to the regular nursery after they've observed her there, okay? Okay. Dr. Pandit will talk to you. You can kiss Mommy. There you go. Say bye, Mom. Yeah, see you
I'm going to
later.
go with her, okay?
What's her name?
Emily.
Emily.
Emily Grace.
Happy birthday, Emily. Need to keep that bracelet on.
Okay. Okay.
You're so cute, huh? I don't know about that. Let's see what happens. We're gonna need this.
Came out looking great, got nice and pink, 8-9 ab bars, but she was a little tachypnic. Her breathing was just a little fast, and Dr. Pandit wanted to bring her over here just so you guys can keep an eye on her for a little
Like I
bit.
said, we're just basically going to treat her like she would be if she was in a mission nursery.
Okay.
Going to put her on a monitor, which is the monitor here, and her heart rate and her respiratory rate will be on here.
Okay.
Saturation, which is the oxygen saturation in her blood, will be just peripheral, but we'll monitor that.
Okay.
We're going to monitor her breathing. Basically, it's the reason why she's here.
Okay. Okay.
Looks like she's doing real well.
Where'd Jim go?
Making phone calls.
Ah, phone calls. Everything went great. Congratulations.
Thank you.
Congratulations. She's beautiful. Like I was telling you back there, commonly when babies are born by cesarean and they don't go through the birth canal, so a lot of the fluid that they're surrounded by for 9 months doesn't get squeezed out. And she's beautiful and pink and just breathing a little fast because it sometimes takes they have to do a little more sucking out of the fluid and out of her throat. This is a temporary step, but it's much better to keep an eye on her in the intensive care nursery, or the transition nursery as we call it, before she goes to the general nursery where she won't have that one-on-one attention.
The retractions and the fast breathing she had has settled down now, has
Yes.
it? Okay. And she only needed supplemental oxygen for
About a half an hour.
half an hour. Okay.
Bathed her.
And you
Temperature
said her
was
sugars
good.
are fine, everything's good about her.
Yep.
I'm sure they'll be glad to see her upstairs.
Yeah. Okay, so. There you go. Cutie. Congratulations.
Thank you very much.
I'm very happy that I made the decision to have the planned C-section. It was great knowing when we woke up this morning we were going to have a baby.
Mothers Jennifer Young and Danielle Nacito have had C-sections. Jennifer gave birth to twin boys and had been losing a great deal of blood. After observing Jennifer closely for 2 hours, doctors decide that her bleeding is under control. She is now in recovery with her 2 baby boys.
I'm feeling pretty good. I've been taking Tylenol today, and the fact that I'm up, I think helps, and I was able to kind of get into my own clothes.
So your main concern is that the patient's uncomfortable and can't move around as well as after vaginal delivery. She's going to have a handful with breastfeeding 2 babies. A lot of mothers with twins are able to do that.
Oh, they're not identical. They are fraternal, but they do look a lot alike. They do look a lot alike. Fraternal means that they came from 2 separate eggs, and they were fertilized separately, as opposed to coming from 1 egg that splits. This is Emmanuel.
And this is Elijah.
Right. Elijah was 6'5" and 18.5 inches. And Emmanuel 7'7" and 19 3/4 inches.